lumbar region of the spine, more commonly known as the lower back, consists of 5 vertebrae labeled L1 through L5. The lumbar region is situated between the thoracic or chest region of the spine and the sacrum. The lumbar spine typically has a slight inward curve known as lordosis. The lower back region contains large muscles that support the back and allow for movement in the trunk of the body. These muscles can spasm or become strained, which is a common cause of lower back pain. The 5 vertebrae of the lumbar spine are connected in the back by facet joints, which allow for forward and backward extension, as well as twisting movements. The 2 lowest segments in the lumbar spine, L4, L5, and L5S1, carry the most weight and have the most movement, making the area prone to injury. In between vertebrae are spinal discs, which cushion the joints of the spine and provide support. Discs in the lumbar region of the spine are most likely to herniate or degenerate, which can cause pain in the lower back or radiating pain to the legs and feet. The spinal cord travels from the base of the skull to the joint at T12L1, where the thoracic spine meets the lumbar spine. At this segment, nerve roots branch out from the spinal cord, running from the lower back through the back of the leg and down to the toes. Some lower back conditions may compress these nerve roots, resulting in pain that radiates to the lower extremities, known as radiculopathy.
So back pain is one of the most commonest health complaints across the globe. Now, worldwide, 1 in 10 people suffer from lower back pain, and it's the #1 cause of job disability. So to what extent has this problem affected you? What do you do when you suffer from backache? Is it permanent, by the way? Is it resolved only by surgery? Is there a connection between backache and working on your laptop? That connection perhaps between backache and the food that you eat? Well, stay tuned because today we discuss backache. We'll be joined in studio by a neurosurgeon, a physiotherapist, an ergonomist, and a biokineticist, all of whom are experts in backache and are going to share their experiences and knowledge, of course, with us. Now, you may want to be part of this show by asking the panel some questions or simply just sharing your views with us. In that case, the number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. Now, we're going to go for a short break, after which we invite you to sit back, relax, and learn from this exciting show ahead. I'm Dr. Salome Daung, and this is Health Talk.
Well, a very good morning and welcome to AM News live at 10:00 hours across all Central Africa regions.
A fitting send-off for a revolutionary giant, a life dedicated in service of the people.
The result means that Swallows are out of the ABC Municipal League and drop to the amateur 4th tier of South African football, the SAB League.
Tune in on AM News every Saturday and Sunday from 10 hours.
I think winter is definitely one of those seasons where you can really show off your sartorial choices. You can start from a single layer of a shirt, actually starting with thermals, build it up with the shirts. You can have beautiful knits over the shirts, like we've done with Jay.
This film tells the story of a very, very significant political figure in the struggle for freedom in South Africa, who happened to be a woman. She was Nelson Mandela's wife.
The exhibition is an exploration into black femininity. Tabitha is a woman of color, and she is exploring the historical exploitation of the black female body.
Newtown Junction Mall hosted an epic contest in the cold where 3 top South African graffiti artists battled it out for the opportunity to become the Newtown Graffiti Face-Off Master.
For your weekly dose of entertainment news, tune in to Trends every Saturday from 12 to 1.
end goal of a chiropractic therapy is to have a spine cleared of all spinal interference so that the nerve system to which the spinal vertebrae are intimately connected is free to function without restrictions. Meet Marcel. He is an industrial designer by profession. He shared with us his experience with lower back pain.
Working behind a computer as a designer, spending long hours hunched over a laptop and that kind of thing, and that creates certain problems. So basically, at some point the pain became too much and I had to do something about it.
The lower back pain affected him immensely at work and at home.
Having discomfort in your back or shoulder like I had in a particular place affected me while I was driving, affected me in sitting just on the couch at home, in sleeping, even at my desk at work, having permanent discomfort. It affects you all the time. So.
His visit to the spine clinic was influenced by him attending Thai massages and physiotherapy. He was later sent to Dr. Martin.
What I tried at first was basically getting, some kind of a massage therapy or physiotherapy and that, and very quickly it turned into a recommendation to come and see Doc Marty. I came through and I saw him, and he started certain diagnoses with me. So testing simple things like, am I physically balanced? Okay, is my weight balanced between my left and my right foot? And from there we worked out which muscles were compensating.
So Marcel came in, it was quite a simple case. It was really just about getting the neck sorted out correctly in terms of getting it moving properly. So the vast majority of people that we treat, we'll just ask them, turn your head and look right, look left, and you'll see that they're restricted in a certain direction. Now our goal as chiropractors is not to fix neck pain. Our goal is to get the neck to move correctly, because once it gets moving correctly, the neck pain starts to disappear on its own.
After being diagnosed, Marcel didn't do many activities to avoid getting back pain.
Like I think most people do, you do something, you go to a doctor or a medical professional, you sort out your problem, you walk away, you think it's sorted out. So for a full year after having my new neck, I didn't do anything.
Lower back pain is mainly caused by many risk factors, but according to Dr. Martin, it is caused by inflammation.
If you can control your inflammation, that's really important. Inflammation is anything that involves pain, redness, swelling, a general lack of function. And the three foods that cause that are sugar, wheat, and dairy. It's a very large component of my practice, giving people advice on what foods to avoid because they promote inflammation, and giving supplements in forms of omega-3 fatty acids and vitamin D. We've seen a lot of value with that. So if there's something I could give to everybody, it would be vitamin D, it would be omega-3, and it would be to cut down on sugar, wheat, and dairy.
Yeah, well, okay. Well, let's learn more about this backache now. Let's welcome into the studio Dr. Wibo van der Meulen. Dr. van der Meulen is a neurosurgeon who's in practice out there at the Netcare Union Hospital in Alberton. Welcome to Health Talk. Dr.
Thank you, Celia. Nice to be here.
Right. Let's start. Okay, we're going to come back to all. This clip that we've just shown, obviously talks about all aspects of backache, yes, from the symptoms right through to treatment. And this, I guess, sets the tone for our discussion. But let's start from the basics. We played a clip earlier that shows, briefly the anatomy of the spine. Just take us through in simple terms. What are we talking about here when we're talking about, the back? And what are the functions of the back? Why is it so important even for us to talk about it?
Well, Silo, I think your clip showed that very nicely.
Right.
If we talk about the lower back, we will call it the lumbar spine.
Right.
And that's an area of interest because it's probably the main site of pain emanating from the spine. Mm-hmm. One of the reasons for this is, as they also mentioned in the clip, that is the area that will carry the most weight.
Right.
And it's also, with the neck, the one area of the spine that is mobile. And going back to that clip, you'll see that we've got 5 lumbar segments. We will call them lumbar vertebrae. But I think you can look at them maybe as a block of flats, with the 5 flats stacked on top of each other, with a little cushion in between. And that's what your lower back would look like. The function would be to keep your body upright, but at the same time to allow mobility. So it needs to protect the vital nervous structures that are there, and it also has to allow for movement.
All right. So when it comes to now prevalence, and I mean, we said it's one of the common complaints, you know.
Yes.
We'll come back and talk about what causes backache. But in terms of the serious kind of backache that, you know, forces you to go and consult and perhaps go through some form of treatment, how common is that?
It's very common. You know, it's said that in the United States, it is second only to the common cold as a cause of days off work. So it's certainly very common, and it is by and large, each person on the planet can expect to have 3 episodes of back pain. Now, look, you can have more. Some people do, and some people have less. But as an average, you can expect to have 3 episodes of significant back pain in your life.
Right. So are there different types of backache then? I mean, you know.
Yes, there are. And I think from a practical point of view, one can look at back pain in this way, pain that's mainly seated in the back, and pain that is mainly radiates down a leg.
Right.
So that will be a practical point to say those are the 2 main pains that we're dealing with.
And let's perhaps focus on the pain. You just mentioned here that you know, pain that's either localized or pain that tends to, you know, goes.
Yeah.
Can you just describe the typical signs and symptoms of backache? I mean, what do people experience, and you know, to what extent?
Normally, a lower back pain itself, and yeah, I'm talking about pain that's in the back itself.
Right.
Normally, will have. You can often associate it with an event, maybe after a long flight in a plane, or bending and lifting a heavy object, and the pain there would also then often be. It's a more deep-seated pain. The intensity, it will be more, rather than a sharp pain, it tends to be more dull, boring pain that is sort of consistently present.
Right.
Whereas a pain that radiates down your leg would be more a sharp, stabbing, lancinating pain radiating down your leg.
Right. Okay. So is it something that is seen? I mean, we've spoken about the fact that obviously it's common.
Yes.
But is it something that's seen exclusively in adults, older adults, or can young people suffer from backache?
Yes. It does. Anybody can suffer from backache, but it becomes more common with increasing age. So the older you get, the more likely you are to experience pain in your back.
What about prognosis? I mean, people that suffer from backache, how worse can it be? What's the worst that can happen?
By and large, the prognosis is good. Usually, episodes of backache should settle down. The majority of people will settle down within 6 weeks on average. You know, it could be sooner, it could be longer. But if you have backache as a general rule, you can expect that pain to settle down. But having said that, it might recur. So, and some people are unfortunate where they have recurring episodes becoming more frequent. But yes, in most cases the prognosis is good, but there are some people that will develop chronic problems.
Well, and just lastly, you know, some people tend to say, look, you know, it's not every pain that should take you to a doctor. So at what point should anybody suffering from a bit of back pain or discomfort, you know, get to a point where it's said, when you get to this point, you need to go and consult? Can you describe that for us?
That's a difficult question you're answering me, but I think the right answer there is most people would have had an experience of pain in the past, even elsewhere. And most people will have an idea of which pain they can sort of live with and will probably settle down or not. So my advice there would be you make that is a personal judgment call. However, there are some red flags. And I would say that the red flags to look out for would be if you're feeling generally unwell, especially if you have maybe an associated fever or something, if there's been weight loss, if you see numbness in your legs, weakness in your legs, maybe difficulty to control your bowel and bladder, those will be red flags, and those would certainly mean a visit to a medical practitioner. Otherwise, I would say you will get a sense of this pain I've experienced before, it's settled down before, or the pain is not settling down, it's getting worse, and that will be the time to see a general practitioner.
Okay. Maybe this is a good time for us to take a break, because I'd like us to just talk about the causes now, find out exactly who's at risk of developing backache and what causes backache.
Sure.
Okay. All of that after a short break. Please stay with us.
With the stories of abuse from the other 8, but they haven't been ready to pursue any angles. They've offered their support, they've offered the comfort to the 8, and it's been an amazing journey.
It feels like your heart actually literally sunk in your shoes.
It wasn't a long encounter. I think at the time I froze.
The way the criminal justice system deals with sexual violence is problematic. And I don't know, unless there's a fundamental change in many things, the way prosecutors deal with the victim in the matter.
For all investigative insights, stay tuned to Special Assignment every Saturday at 17:30.
What guides us? Is it something you can touch, hear, feel, or see? What leads us onto greater experiences? Is it leaders on a soapbox, spouting rhetoric for the crowd? The advice of our elders? Or is it the actions of our people? The strength of our beliefs? Or the voices of our citizens? Your country is guided by the voices of its people, and your broadcaster is dependent on your voice to guide it. Get your copy of the SABC's editorial policy and have your say.
Welcome back. Well, backache, as we've learned, is such a common thing that you probably would have suffered from backache at some point in your life and you wondered, but what's causing it? Well, we're going to be told that answer is going to be answered by special guests, Dr. van der Meulen, who's a neurosurgeon based out at Union Hospital, and we're joined by another special guest, and this time it's by Esmeralda Kellen, who's an ergonomist from a company called Ergo Focus. Welcome to Health Talk.
Thanks. Nice to be here.
All right. Dr. van der Meulen, let's get back to you now. Talk about the causes. You know, just now we spoke about, you know, different ages and so on. What are those common causes of backache?
Silo, if we talk about, and you remember we spoke about, you might have pain in your back itself, and you might have pain sort of radiating down a leg. The pain radiating down your leg is usually a nerve that's pinched or irritated. So that would be one of those little cushions that we spoke about in the back. That's the most common cause there. We'll be pushing on the nerve, irritate the nerve, give you pain down your leg. When we get to the causes of the back pain, there are more, and they're often very difficult to put your finger on exactly what is causing this specific patient's back pain. But the common generators of pain would be, you remember from your video that you showed before, the facet joints, so the little joints between each vertebral segment. So those little joints can, as your knee or your hip or so become painful, that's degeneration, aging. So same in your back, you can get pain from those joints. The other common place is the disc or the cushion between the bodies. That becomes degenerate. You can get a little tear in that disc. That's very painful. And then, of course, ligaments, muscles, and so on. So back pain has multiple causes, and often very difficult to identify one only as the cause of the pain.
Okay, well, I'm going to ask you about infection just now, but let's take Aisha on the line from Johannesburg. Aisha, welcome to Health Talk.
Hi, how are you?
Good, how are you?
Fine.
Your question, please.
And I've had my hysterectomy about 18 years ago, a vaginal hysterectomy.
Yeah.
But I am suffering with a lot of back pain, and now it's running to my spine. And I am incontinent of the urine. But tomorrow I am going to take the Razon injection. Is it good enough for me to take it?
All right. Okay. Excellent question. We're going to get back to that, Dr. van der Merwe. I think it's about that type of injection. Perhaps we keep that at the back of our mind when we talk treatment, and then we'll answer that question.
Sure.
Correct.
Sure.
Okay. Let's carry on now. Are there any infections that can give us backache?
Yes, there are, and I must say that infection as a cause of back pain used to be fairly rare. If you see a lot of patients with back pain, you would see some. But lately, I guess it's with organisms, the bacteria and so on, becoming more resistant, more virulent. We see more of it. But still, as a cause, it will be a minor cause of pain.
In the earlier clip we played, somebody mentioned food, glucose, sugar and whatever else, foods is causing backache. Your comment on that?
I think from a practical point of view, I wouldn't sort of, in an effort to sort of deal with back pain, that's not a priority. I would say that there are other priorities.
Okay. Esmeralda.
Yes.
We spend quite a lot of time at work. In fact, the great majority of our time is spent at the workplace.
Yes, we do.
And there are issues there that obviously might lead to backache.
Yes.
Please take us through. First of all, tell us a little about what ergo focus is and what you do. And people are wondering, what's an ergonomist now?
Well, basically, an ergonomist is a person that, or at least that I specialize is in physical ergonomics, and I basically try to fit the work environment to the person instead of the person to the work environment.
Right.
So, in general terms speaking, if I can use an example, if you've got a palletizing situation in a factory and the pallets with the loads are on positioned on the floor, then a person would have to bend down in a repetitive way to lift up the heavy bags onto the conveyor or from the conveyor onto the pallet. And if a person has to do that for 8 hours a day, day in, day out, year after year, then it causes damage to the lower back. Because they're always being moved in the same way, out in a repetitive way. The heavy load that always puts extra forces on the lumbar spine, as well as tissue issues.
But is it only people that are involved in heavy work?
No, you also can have any basic static posture. So it can be static sitting in the office, or standing at a till in a supermarket, or standing at a production line in a factory. If you don't move around, then your muscles basically don't have their pumping actions. So the nutrients don't go in the muscle, and the waste products are not being pumped out of the muscle. So the muscle fatigues very quickly, and therefore is more prone to injury.
What about people such as, drivers whose job it is to sit and drive for long hours? Do those get backache?
Yes, because they also have the added point of vibration on. So if you look in our own country, in South Africa or in Africa, where you've got a lot of sand roads, bumpy roads with jolts in as you're driving, then and the stress of traffic, having to accelerate, decelerate, having environmental aspects that contribute to lower back pain. And often people don't set up their the vehicle seats properly. Yeah. So then it puts their lower backs in a disadvantaged posture.
Right. Lots of people use computers these days, laptops and so on. Yes. And there's been some association with computers and backache.
I get a lot of people that have got backaches associated with computer use. Right. If you look at the laptop, to say it very quickly, you have to basically hunch over to a laptop in order to look at the computer screen. And often your laptop is at a desk, because of your chair, you're sitting too low at it, so you often have to raise your elbows. So if I do it in a bit of an exaggerated manner, you would be sitting like the Hunchback of the Notre Dame, which is fine if you do it for like 20 minutes. But if you do it for 8 hours a day, 5 days a week, so that is basically what we as ergonomists look for, is things that that happen over time by sitting always in the same awkward posture, and then that aggravates back pain.
Right. So I mean,
aggravates.
Perhaps just take us through what an ergonomist does when you get to a workplace. I mean, what are the typical things that you come across, and how do you get them corrected for the sake of the
Well,
employee?
we basically first go through a task analysis per job category. So if it, for example, is it a fitter, is it an office worker, and what does he do per day, and what does he do most of the day? So is it lifting, is it using repetitive tools, or is it computer work the whole day, or is it staring at a screen? And then we analyze those major factors in such a way that we can see what the risk factors are, and then weigh them accordingly to the duration of their exposed to it, so that we can see whether the design is properly or not.
Okay. Just lastly, when it comes to weight, oftentimes you hear that people that lift objects, there's a maximum weight that one person cannot lift. Is there any such?
No. There is no maximum. It's not so much about the weight that you lift, but the way you lift it. Right. So you can lift a very light load from the ground, but if then you put your body in the most awkward posture there is, and if you also have a high BMI, you also have to lift your own upper body with it. So then the allowable amount of weight that you can lift up is a lot less. So. Yeah, it really depends on the fact that have you got a good grip? Can you lift it from the floor? What is the working height? Do you have to reach far? Because the further I have to reach, the bigger the momentum is on my lower back. If I keep my load close by, then I can lift a higher weight.
In last 30 seconds, Dr. Van Medelen, we often hear the story about older people just lifting something from the floor and then they end up with sharp backache.
Yes.
What is the mechanism there? What is going on?
Well, the most common mechanism there would be, as we age, those little cushions between our discs start degenerating. They become more brittle, they lose fluid and so on, and you can get a little tear. That's the most common. But in older people, poor bone density, osteoporosis, becomes an issue. Yes. And it's not uncommon for older people to injure themselves and actually get a fracture of the back with a sort of a minor trauma, as you explained there. Okay. So there will be a few causes, but those would be those sort of the two ones to look out for.
Okay, well, as Esmeralda Cullen, ergonomist from ErgoFocus, thank you so much for your time.
Thank you too.
Okay, folks, we're going to go for a quick break. When we come back, we now talk about the important subject of how you can prevent yourself from suffering from backache. Please stay with us.
We take an in-depth look of all your stories of the day across the world.
Last month, Mkhwebane said that the bank had failed in its duties to protect the public by not ensuring that ABSA repaid an apartheid-era bailout given to the failed bank, Bank Corp. The rand fell nearly 2% on her remarks.
My effort, in my opinion, is going to be to build a Zimbabwe that I believe in, as opposed to remaking a Zimbabwe of the past that I cannot do anyway. So I'm absolutely clear on this.
We need to start showing more commitment by government that they are committed to working with business, and therefore that should start to stimulate confidence, and with confidence comes investment, and with investment hopefully comes growth.
Stay tuned to Primetime News every day from 18 hours.
It's a myth that you lift with a straight back. The spine is actually shaped like a lazy S. The lazy S allows for flexibility and should be maintained to ensure a healthy, neutral, round disc position. There are 24 discs between vertebrae in the spine that could be injured by an improper lift. Back injuries include bulged or herniated discs, which most commonly happen from overexertion while lifting improperly. To avoid injury, we need to maintain an upright, lazy S posture. When attempting a lift from ground level, go to a catcher's position. This enables good balance and maintains the neutral, healthy, round disc position. To accomplish this, assume a wide stance, shoulder width apart, with feet diagonal for better balance. Look ahead, never down at the object. Keep arms inside the knees, grip underneath the object diagonally, and bring the load close to the body. Now, fold the object to your power zone. This is the area between your sternum and belt buckle. Keep elbows in close against your body. Then, fold the object to your power zone using your arms, shoulders, chest, and back. Always bring the object to your power zone before trying to stand. Note, if you cannot fold the object to your power zone, get help. Once the object is brought to your power zone, the weight is balanced within your center of gravity, and all muscle groups throughout the body are used when you stand. Once in a standing position, and to transport the object where you want it, use your feet to face your work to maintain a neutral, healthy, round disc position. Never place the object with your feet planted to avoid pinching a disc or twisting your spine. Instead, step in the direction you wish to place the load. Lead with your right foot to go right, or lead with your left foot to go left. When ready to release the object, always release it from your power zone. Position yourself as close as possible to where you want to set the object. Go to the catcher position and release the object only when balanced and ready.
All right, well, that's exactly what you need to do if you want to avoid backache at the workplace. Well, welcome back. If you just joined us, thank you so much. We're talking backache, and we're with our guests. First up in the middle is Dr. van der Meulen, who's a neurosurgeon based at Alberton Hospital. And we're now joined by two other special guests, Professor Yoga Kupu, who is himself a biokineticist and head of Department of the Sport and Movement Studies at the University of Johannesburg. Welcome to Health Talk, Dr.
Thank you so much.
All right. And we're also joined by another special guest, who's a physiotherapist, and Jean Marai, who is based at somewhere in Dunkeld West. Is that correct?
That's right.
Welcome to Health Talk.
Thank you. Thanks for having me.
Before we start our discussion, we have two callers on the line. I'll take them one after each other. The first one is Teresa, calling us from Cape Town. Welcome to Health Talk, Teresa.
Good morning to all of you. I'm Teresa. I've been diagnosed with osteoporosis arthritis 4 months ago.
Yeah.
I've been on a group of tablets. I attended the day hospital. I've been given a group of tablets, which up till now hasn't really helped me. I've been back for x-rays for my lungs and chest. I've developed 2 muscles under my breast.
Yeah, 2 lumps under your breasts, so to say.
Yes, it's like spasms. And they like almost like golf balls, and I've just been massaging it, and the doctor said it's part of the arthritis, that I'll get spasms all over my body.
All right, okay.
Now I've changed my medication. I've now gone on to osteo-E because of the ulcers. I've gone on to osteo-E and a cod liver oil tablet. But I'm still in constant pain. Is there any advice to alleviate me from my pain? I'm in constant pain.
All right, Teresa. Thank you so much for a question, and I'm so sorry about your pain. We'll try and get to see if our guests can assist you there. Let's take Akima on the line from Cape Town as well. Welcome to Health Talk.
How are you, sir?
Hello, good, how are you? Sorry, who?
I'm good, and you, sir?
Avina, we seem to have a cross line. Is this Avina? Akimu, Akimu, are you with us?
Yes, I'm still there.
Okay, your question or your comment, please?
I was having problems in my lower back when I was 12 years.
Yeah.
And now I'm 30 years, and I'm still having lower back. I did go to the doctors to find out what's the problem. They said they can't see any problem. So I was wondering, is it going to solve the permanent problem or is it going to get fixed?
And you've had this problem since age of 12?
12, yes.
All right. Thanks for your question. Let's take the last one, Nazima from Cape Town. Nazima, are you there?
No, I'm Foster, not Akim.
Sorry. My apologies, man. Your question, please.
I just want to know about what are the causes of the back pain? And what are the damages that can cause to your body pain?
All right. Thank you so much for those questions. All right. Guys, we have 3 people. We have to take 3 quick questions. First, let's start with the first one, and I'll put it to anyone. Somebody with osteoporosis and now has these muscle spasms under the breast. Anybody would like to take a step?
I think the first thing about osteoporosis is osteoporosis can catch you out.
Right.
In that you have subtle fractures. Remember, normally with normal bone, it will take quite a big injury and you can have a fracture. With osteoporosis, you can have a subtle fracture, severe ongoing pain. And so there are 2 things there. If there's ongoing pain, I think that she needs to be investigated further.
Yeah.
And I think the first step would be to sort of try and identify the source of the pain. Right. That will be the first thing. And if that, and secondly, of course, the osteoporosis will need to be treated.
So what sort of medical professional would she need to consult?
I think she would do well to start off with a general practitioner.
GP, okay.
And for him to get a general idea of her health and so on, and to start the process.
All right. Okay. The next question was somebody who's had backache since the age of 12, and I just couldn't get what the cause was and whether or not it'll get better with time. Your experience as a physiotherapist?
We're seeing more and more that people are having back pain that is not necessarily resolving with conventional treatment. And conventional, I'm talking about the past few decades of what would be assumed to be the normal treatment.
Yeah.
So if, for example, this person has gone to a GP, they've gone to a specialist, they've had an MRI, they've had an X-ray, and nothing was found, there are a number of reasons that could be still contributing to why this person has got pain. there's on the one side the fear and the way that this person is moving because he knows that he's got pain and he knows that he needs to protect himself, because society has been telling us for decades that when you are painful you need to be careful, you need to slow down, you need to rest. And our research is proving that it's not the case. You need to move, you need to trust that your spine is strong and that you can move and that you can live normally, and that obviously even more so if you've already had a normal x-ray, normal MRI, we're not sitting with a fracture or anything sinister.
Right. Prof, we need to start our discussion on prevention. I'm going to start with you in terms of, what those simple exercises people can do to try and prevent backache. But before that, Nazima is back with us from Cape Town. Nazima, welcome.
Hello, good afternoon to the panel. I just need to find out that I have pain from my neck down to my lower back, and on my right side I have actually sort of a lump, but between the neck and the shoulder blade, it has this pain that continuously there, and it's really every day. I cannot sleep, and what I really want to know is my young days, I played table tennis and badminton. Could that be the cause of the hump that it's developing now? And my shoulder is paining as well, and I can only sleep on my right side.
Thank you very much, Nazima. Maybe let's put it to you, Prof. Any association between playing sports as a young person and development of backache later on?
I mean, there are instances, yes, but in this case, I'm sure the neurosurgeon will speak more about it, because I think there is some osteoporosis developing, and as a result, the hump in the back is obviously forming, right? And I don't think it's related to earlier sport in terms of badminton or table tennis. Maybe
Dr. Vermeulen, do you want to just perhaps comment any further?
Yes, I will agree with the Prof there that I think, in fact, sport, especially what she describes, will probably have been sort of beneficial to her, if anything else. But yes, that's a common, it's called a dowager's hump. And as we see it more in women, and as they age, the medical name for it is a dorsal kyphosis. It's in the chest area, and it's a curve standing like this that becomes more pronounced with age. And basically what that is, it's the vertebral bodies collapsing slowly, causing that angle to sort of increase over time.
But if it's causing her pain, can something be done about it?
Yes.
Okay.
Yes.
So she must just go back and consult her.
Yes.
All right. Let's get back to what we need to be talking about now. How can people prevent themselves from suffering from backache? We started off by showing a clip on the proper way of lifting heavy objects. General public out there watching.
Okay. I think exercise plays an important role.
Right.
Particularly in terms of your core stability. Trying to improve the muscles around your spine so it sort of forms like a corset around the spine, so it provides stability for the individual. And obviously very specific exercises, which we will show a little later on, could be done at home. And basically if there's no pain, I mean the person shouldn't be doing exercises if there's pain, then they have to go back to the physio to actually find out why the pain is obviously occurring. Flexibility is another important aspect, particularly with lower back pain, because as you get older, your flexibility decreases, and as a result, the flexibility within the muscles around the back decreases, becomes stiffer, and hence it exerts pressure onto the spine, thus allowing, again, the fluid in the gel to actually pop out the discs within the spine. Losing weight is obviously one of the other important activities that could be done in terms of improving backache. And then, as the ergonomist said earlier on, stand smart, sit smart is obviously important. And just a few tips on that. If you're standing for a long time, maybe you have a small little stool or something that you could put your foot on and then stand for a while and then change that, particularly if you're teaching or you're doing some standing in as a shop assistant, etc. Or even as a secretary sitting at a desk, or anyone sitting at a desk using the computer for a long period of time, to have a workstation. So you actually stand up and work on a higher level so that you relieve the pressure of sitting, which is one of the main problems, or just getting up after every 45 minutes, walking around, visiting a friend, and then obviously getting back. But those are your sitting smart, standing smart is obviously an important aspect in terms of prevention.
Okay. Jean, you see a lot of people with backache. I mean, they come and see you. So what are those things that you pick up, the common things that result in the backache that you'd like to then say to people, please, these are the things that you need to do to avoid getting backache?
Okay. I think the primary cause for majority of the patients that I do see would be that they've suddenly changed something.
Right.
And that change is not necessarily for the worse, it's just a change and your body hasn't quite gotten accustomed to it yet. That could be that you are suddenly starting a new exercise. It could be that you are changing jobs and you are no longer using the external monitor that you had before. It could be that your job has totally changed, not from one desk to another, but it might have changed from being desk-bound to now being a rep for a company where you are out and about, you are driving, you are talking, you are walking. And those changes definitely have a big impact. There's also the mention we've already heard of age playing a role. Besides the physiological factors that start playing a role with your age, we also have to see that that person has had a history. And that history may have included a car accident and you've totally forgotten about that because it was a small bumper bashing 10 years ago. But if your movement was never quite the same after that because of that fearful positioning and posture that you had, then you can over time encourage poor movement and encourage fear and eventually encourage pain or the perception of pain despite actual tissue damage being present.
Okay. We're going to come back because I'd like to learn more about what you now do for people that have backache, how you treat them. But then, after a small break, please stay with us.
Hello and a warm welcome to PM News, and we're broadcasting live from Johannesburg.
4 decades later, the family is still seeking closure.
We need the truth, and the truth must be told.
Children often go undiagnosed because they are hidden away. About 1 million people in South Africa live with autism.
Creative recycling at play.
Mosaic has been around forever. I just had to find a new, fresh way to put and a new spin to put on it. So I decided why not recycled cans.
Stay tuned to PM News for all your news updates every Saturday and Sunday from 1500 hours.
What guides us? What leads us forward? Is it the words of our sacred texts? Is it the actions of our people? Or the voices of our citizens? Your country is guided by the voices of its people, and your broadcaster is dependent on your voice to guide it. Get your copy of the SABC's editorial policy and have your say.
Africa is constantly getting new technologies, and with that comes new terms.
Massive, open, online university. And primarily what they are doing is they're established in the community, so they're well established within the Soweto community.
Internet of Things also covers small sensors, so you can do like home security, motion detectors, IP cameras.
On Network, we simplify these terms for you. We also have new gadgets and social media.
When it falls on the grounds and then the battery, everything falls off, people just put it all together and then your phone is back in shape.
The Valega app, we initially started off by doing this manually.
The internet is actually my favorite fashion invention of all time.
That's Network with Ms. Pumelele Zondi every Sunday at 9 p.m. on SABC News.
Welcome back. We're talking backache with my guest, neurosurgeon Dr. Vermeulen, biokineticist Professor Kupu, and physiotherapist Jean Marai. We're talking backache. Please, we shouldn't forget, we had an earlier question about, treatment of backache with some type of injection. And perhaps let's start with you, Dr. Vermeulen, in terms of the principles of treatment. What treatment options are out there for people with backache? I would imagine we're talking backache that requires some form of treatment.
Yes. Look, of course, by the time I see a patient, ideally one would have wanted an exercise program, a back school program where the patient is taught how to look after the back, etc.
Yeah.
So usually invasive treatment, and at that point medication would be an option. The medication will often be a combination of different drugs, different classes of drugs that work in different mechanisms. That way you could keep the doses of those drugs lower, side effect profiles better, etc. Once all these things in place and people still suffer, you would sort of ideally look at a program that stepwise increases the sort of invasiveness of the treatment. And you've mentioned, and one of our callers here mentioned injections. There are numerous sort of injections that can be done to the spine. They will range from those that will target the little joints, those that target discs. There are epidural injections that we can give. And they often have two sort of goals. The one is they can help you to make a diagnosis.
Okay.
And secondly, they can treat the pain.
All right. So not to rush you, but at what point do people need surgery?
I think, yeah, it gets a little bit technical in this sense that there are absolute indications. And those will be indications that an operation has to be done. And that will only be where nerve roots are under threat.
Okay.
And this is once again where we're talking about conditions like a cauda equina syndrome. That's just a technical word for where all the nerve roots are pinched so badly that patients lose function.
Okay. But for all intents and purposes, it's a decision that will be taken between the patient
and the doctor.
And the doctor.
Yes.
Let's just quickly go to physiotherapy. What do you do in the initial periods of treating backache? What sort of, we hear there's acupuncture, there's cupping, and there's all sorts of things, massage. What do you do?
It will depend greatly on what's actually to blame or what we in our assessment find is the most likely cause. If we do feel that a muscle spasm is the only culprit, then definitely we can do needling. There will be myofascial release to help the body move better. If we find that it's more joint irritation, and it could be from the joint being put under excessive strain because another joint is stiff, or it could be from stiffness in that joint itself. So in that case, we might work more on mobilizing the joint and teaching the patient how to mobilize it effectively themselves. But definitely a very large component is education and teaching a patient to take responsibility for their pain, to not, for example, we often hear, I'm sure I'm not alone, where people say, I've had this, I've had that, nothing's worked. And sometimes, yes, it's because nothing that's been done was correct. And sometimes it's because the person expected the health professional to fix it for them.
Okay.
And it's very rarely the case that we can do that. We can enable a person to look after themselves better.
Prof, something called final phase rehabilitation. What is that?
Yes.
We, in the last 2 minutes that we have for the show, perhaps you want to tell us what that is and demonstrate some of those exercises.
Okay. Final phase rehab is obviously after the physiotherapist, which is just indicated all the treatments to relieve the pain, to relieve some of the tension and anxiety of the patient. Then it would come to the biokineticist, where we would then do an assessment firstly to find out if there's muscle weaknesses, if there are problems in terms of flexibility. And then based on the assessment, we would then develop an exercise program.
Yeah.
Obviously from the very basic, building it up. And
just show us an example of an exercise program.
Okay.
Quickly, yeah.
Okay, Cheryl will demonstrate for us a side plank, right?
Okay.
And the important aspect of this exercise is obviously to keep the core tight. So she'll pull her tummy in and obviously hold it in that position. The body would be straight, and she'll hold it between starting off maybe 10 seconds in initial stages and then building it up to about 20 seconds. Cheryl, could you show us a cat and a camel? Okay, this is another important aspect. You can see the back's quite straight, and then she pulls the tummy in, and then she lifts it right up, pushes right out, and she holds it for a while, and she relaxes, she breathes as such.
Yeah.
Then we'll go from that position.
The last exercise?
Yeah, from that position we'll go into what's called a Superman, right? Which is lifting of either the right or the left leg up straight, but the important thing is to let the leg and the arm and the back be straight. It should be parallel. We shouldn't have a hump in the middle of the back, because that would cause further impingement if there is such a
and obviously that would be on both sides.
Yes.
Yeah. It's a pity that we didn't have enough time for all of this, but thank you so much to our guests. First up, Professor Yoga Kupu, Head of Sports and Movement Studies at University of Johannesburg, Dr. Vivo van der Meulen, neurosurgeon based at Alberton Union Hospital, and Jan Marai, physiotherapist based at Dunkel. Thank you so much for your time. Well, folks, that's all we had for you today. Hope you learned as much as I did. You catch us next week, same time. And until then, cheerio. You take care.
Fashion influencers are diversifying the industry, leading a fashion revolution like never before.
It's time for us to come together now. What we face is the most significant moment in the history of this subcontinent.
Armstrong uses still with soft drawings and watercolors to create a disruption within the exhibition.
What you see in the show is almost like a snapshot of me as a being in process.
The band's so excited about their latest creation and believe it's their best work yet.
It's a happy album. It's got 8 tracks. First single, which is Nana in it, and Nana is pumping already.
For your weekly dose of entertainment news, tune into Trends every Saturday from 12 to 1.